Hello, this is Dr. Grande. Today's question is, what are the differences between Rational Emotive Behavior Therapy, REBT, and cognitive therapy, CT? So this is an excellent question, and these two modalities at first glance really seem quite similar, but there are some key differences between them. REBT and CT are both types, they're both versions of cognitive behavioral therapy. Now, oftentimes when we hear a therapist say that they use CBT, cognitive behavioral therapy, they're talking about one of these two modalities. Most of the time in a situation like this, they're probably referring to Beck's cognitive therapy as opposed to Rational Emotive Behavior Therapy developed by Albert Ellis. But either way, these are both fairly popular modalities. Let's look at some of the differences between REBT and CT. The first would be that REBT has a fairly simple structure. The cognitive model, as is explained in REBT, is based on ABC, activating event, belief, and consequence. The consequence, of course, can cause another activating event. In cognitive therapy, the cognitive model is substantially more complex. It has a stressor, which is similar to the activating event in REBT. It has a reaction, which would be similar to the consequence. But the belief component is really broken down into three areas in cognitive therapy: the core belief, the intermediate belief, and the automatic thought. So the core belief would be a deeply held belief. This is usually formed through childhood experiences. The intermediate belief is more of an attitude, rule, or expectation. And then the automatic thought is the thought that the client's thinking right in that moment, when the intermediate belief combines with the stressor. When I look at these two theories, really the cognitive model in cognitive therapy seems more complex, but it's also more precise and refined, in my opinion. So that's really a key difference between these two. Another difference is that in REBT, the role of the therapist is as an expert. In cognitive therapy, the role of the therapist is considered more like a co-discoverer of solutions, a collaborator. So the way of being in cognitive therapy is a lot more like person-centered therapy than is the way of being we see in rational emotive behavior therapy. Another difference is that REBT is highly philosophical. So it has a simple structure with its cognitive model, but there's a lot of philosophy behind it. So in that way, it's more complex than cognitive therapy. Cognitive therapy has a concrete way about it. So there are advantages and disadvantages to these two styles, but I view REBT as much more philosophical. Another difference is in REBT, unconditional self-acceptance is really stressed. So it's the idea that the client can learn to accept themselves unconditionally. In cognitive therapy, the focus is more on the therapeutic alliance, which leads to unconditional other acceptance. That's where a client understands that another person can accept them unconditionally. Similar to this, REBT has unconditional life acceptance as one of its principles. And this is really an existential concept. So again, REBT is more philosophical. It has more existential therapy woven into it than we see with cognitive therapy. In rational emotive behavior therapy, the therapist is a little bit confrontational, certainly assertive, and highly directive. In cognitive therapy is a bit more polite, and it's somewhat directive, but not nearly as directive as rational emotive behavior therapy. Now, it's worth noting with this particular difference, and this really does apply to a few of the other differences as well, is that an individual therapist can modify this component of REBT or cognitive therapy. So you could have a therapist that uses REBT in a less directive way or uses cognitive therapy in a more directive way. The last difference between REBT and CT that I'll cover here is really about the popularity. Cognitive therapy is substantially more popular than rational emotive behavior therapy. There's a lot more research on cognitive therapy, and repeatedly cognitive therapy has been shown as effective for a wide range of mental health disorders. Now, of course, it's not effective for everybody, but it's effective for most people. REBT has some research that supports it, and REBT has been shown to be similarly effective. So both models have, in some sense, established that they're effective, but there's just a lot more research to support cognitive therapy. As I mentioned, when therapists talk about using CBT in their practices, a lot of times they are referring to cognitive therapy. It really says something about the popularity of this modality that the term CT becomes confused with the term CBT. We don't usually think of that happening with REBT. So those are some differences between REBT and CT. I hope you found this description to be useful. Thanks for watching.